look at markets, everything in terms of sentiment and everything in terms of isolation. But remember, it's getting bad, it's getting terrible. In some pockets, it's getting horrible. The number of cases, the requirement of beds, the shortage of medicines, the shortage of oxygen, it's just coming together. And it's not a scary situation, it's a terrible situation. And to understand that, what is the way forward? How exactly are big all India chains gearing up in order to fight this crisis? The medical fraternity is putting the best foot forward. So we must also appreciate that the limitation of the infrastructure is something which is real, and the spike in the COVID is unreal. So how do you manage when the spike is unreal with a real situation of medical infrastructure? Abhay Soi joins us, Chairman and Managing Director with Max Healthcare. Mr. Soi, good morning. Thank you for joining us. The number of cases, the shortage of medicines, the shortage of oxygen, we all know the problem. But how are you gearing up? How are you coping up? What are you doing to ensure that whatever best can be done is being done by your chain of hospitals?
I think first and foremost, I want to start with what is it that we can do in order to manage this crisis that we all have it at hand at present. We clearly need to outperform or outrun the pace of the virus. And this is what we'll be only able to do this if we are able to slow down the pace of the virus, as well as, give us time to augment the capacity. It's a very, very steep climb, and no healthcare system, even if you had idle beds lying, would be able to ramp up to this extent at such a short period, because we've pretty much gone 3x in terms of COVID bed occupancy. And the huge pressure on the healthcare system. Of course, it's going to have some amount of disruption in supply chains, because even at the back end, the supplies haven't been that quick to sort of to complement this addition in capacity. So what we need to do is we need to slow down the virus. We can slow it down through maybe micro lockdowns without much collateral damage to the rest of the economy. Give some breathing space to restore and to streamline, the supply chains. Okay, whether it's oxygen, whether it's tocilizumab, remdesivir, some of the other life-saving drugs, and so on. Because you need to give it some space for it to ramp up, as well as the ICU beds and the rest of the healthcare infrastructure. As far as Max is concerned, we had 600 patients, for COVID, which has gone up close to 2,000. This is in a space of 8 days. We are ramping up capacity very quickly. We'll be able to increase it by another 30 to 40%. Having said that, it's not infinite. We are going to come to the brink very, very soon, even with respect to what we can do going forward. So, the only choice we have is to slow down the pace of this virus.
Are you looking at also expanding beyond your hospitals, which is outside the existing infrastructure? I'm aware of some hospitals which are taking charge of hotels, quarantining big guest houses. They are offering to state government that they will be able to manage large, jumbo facilities. Are you thinking on those lines?
We're also doing that. We've taken over hotels. We are also treating people through home care. But you must understand that today's date, people who come to hospitals are very severe to serious cases. They require high flow oxygen. They require critical care. They require ventilation and so on. And these are not things which you are able to replicate in jumbo centers, in hotels, and even in home care environments, because you need critical care support over there. Most people today are managing, low to moderate cases at home. Through themselves, through GPs, through home care. Some are going to hotels. But, where do you go from there? When a situation escalates, you still need a hospital environment. You need a critical care setup, which is very, very difficult to do in a hotel environment.
Let me ask you something which I'm sure you also are going through, which is that friends, family, acquaintances, they all are reaching out to us. Somebody needs plasma, somebody needs hospital, somebody needs a reference for a medicine. How should one deal with it? How are you dealing with it? What if What should I do when I get a reference and when I know there's a critical need?
You must rush to an emergency. I think, the triage is done in the emergency. The allocation happens through the emergency. It should happen through the emergency. Only serious cases, you may believe that you require a certain sort of medical support, and everybody through Google is a doctor today. But, the people at the emergency are geared for it. If you're serious, they will stabilize you. Nobody's being sent home. So all of those things are done. I think the important part is in this whole in this whole situation is that when we had the numbers going down, we still didn't have enough vaccination. And one of the issues that I see today is our vaccination centers are operating at less than 40% capacity. So you still have this huge amount of vaccine hesitancy which is happening. People aren't coming and getting vaccinated, because some people believe that even after 2 shots, you can get infected, which is the case. We've out of the 25,000 healthcare workers that we've inoculated twice, and over the 125,000 public that we've inoculated, we've had 100 odd cases of people who've been reinfected. But I must tell you, whether it's Max or any of our peer groups, I've checked all on their data as well. There hasn't been a single case of severe COVID where a person has had to rush to an ICU after being inoculated twice. I think, we need to break this chain by vaccinating, by doing these micro lockdowns. If you have an issue, please rush to an emergency rather than making calls. I think, that's the best way forward.
It is such an important question which you've answered, that the vaccines are working, and that is coming from the chairman of Max chain of hospitals, who has access to data, and he's giving scientific and medical evidence that the vaccines are working. So our first pitch to all our viewers, everybody watching this show online, digital, will watch it later on, please get yourself vaccinated. That's the only way to break the chain. Mr. Soi, my next question is something which you've already answered about the second vaccination. People who got the second vaccination, it is working for them. But what about the first dose? 12 crore Indians have been vaccinated according to the official data. How come the chain is not breaking? Because 12 crore is still a large number.
If you actually see the data which is coming out, and I think one of your newspapers only published that today, is that even amongst healthcare workers in India, you only have, and frontline workers, you only have 37% of the people who've been vaccinated and inoculated. If you look at the group which is above 65, you only have about 45% who have been vaccinated in these cities of Maharashtra and Delhi. You can imagine what the situation is in tier 2, tier 3 cities. 12 crore people, and on a base of such a huge population is a drop in the ocean. People who have access to the vaccine there's been a huge amount of hesitancy. We have parity number of people, really at our vaccination centers. And, you have others, who don't have access to vaccine, the younger age groups, etc. And, some of those people are demanding. But, the rush isn't too much for people who have that access.
Right. Abhay, I was just going to come to that, because while we are grappling or were grappling with a bit of a shortage when it came to vaccines, you think the larger need right now is to get the super spreader age group vaccinated, people from 25 to 35 who are actually out and about and spreading the virus?
I think it is more important to get you will never have, so many vaccines as to be able to sort of vaccinate the entire population very, very quickly. You have to do this sequentially. And when you do it sequentially, you have to first approach the more vulnerable age groups rather than the spreaders. Do keep in mind, spreaders are spreading, but their mortality rate is much, much lower than people who are vulnerable. So you need to kind of, you need to protect not the spreaders, because the vaccine doesn't stop you from getting infected in the first place. It stops you from a lower mortality rate or from getting into a serious situation thereafter. So if a vaccine isn't stopping you from getting infected, then you may as well be vaccinating the more vulnerable age group first, which has a higher mortality rate. You still have 70-75% plus of mortality in the higher or the more vulnerable age group, which is 65 plus, 45 plus with comorbidities and so on. Whereas the younger age group is more susceptible, perhaps because they're going out, but they have less chance of mortality in that situation. And in any case, you don't have enough vaccine to go about. So, rationale states that you need to do it sequentially. You need to kind of approach and this is what the government has been doing, but you need less amount of hesitancy out there. You need to implore, we need to implore everybody out there, including healthcare workers and others, okay, to get themselves vaccinated. I mean, I can't stress that enough.
Right. Also wanted to understand, Abhay, whether or not the mortality rate is a lot lower this time, because there's a lot of misinformation out there. People are more dependent on hearsay and WhatsApp group infos than what the actual stats are, because like you said, anyone on Google thinks that they are the know-all and end-all when it comes to the virus. Help us understand whether the mortality rate is lower than the first wave back in last year.
Look, it's very difficult to sort of compare these data points because, in order to compare the mortality rate, you have to know what the base is. How many people were being tested in the past, and out of the people being tested, how many were coming positive versus what is happening today. Previously people, even if you had COVID, you were being shunted to hospital by regulation. Thereafter, it changed to if you have moderate or any symptoms, you're being shunted to hospital. Today's date, you're comparing a situation where only moderate to severe people are in hospitals. And many, many more people are getting perhaps vaccinated, but at the same time, many, many more people are outside that net. So you don't actually have data in terms of how many real people out there are sort of infected. It's a wrong comparison, but anecdotally, at least what we are seeing is, yes, people this time around, it's less infectious in terms of it's less severe, the virility is less. Having said that, the quantum is so much that the number of people who are coming to hospitals with serious situations, and this is not really a reflection of perhaps how virile the virus is, but more in terms of what the quantum of people or what its infection load is in terms of it's been spreading so fast.
So given that we're dealing with a whole new beast this time around with the daily new cases already 100% more than what we witnessed in the first peak, what do you think would be the need of the hour from the government standpoint? For instance, we did see this price reduction from the pharma companies as well of the Remdesivir drug, but what else at this point in time do you believe needs to be done?
So I think the government, the healthcare system, be it the central government, the state government, or the healthcare system, okay, it can only do this much and no more. And today, in terms of capacity, in terms of supply chain, in terms of what we can do and so on, okay, you're getting to a point of no return. I mean, we're pretty much already there. I think this is a responsibility at every individual's hand. And it's not a central subject, it's not a state subject. Health is the individual subject. More than the government, I would implore the people to keep themselves safe. This virus does not spread, on its own through television and telephones. It spreads because you step out of your home, and when it's airborne. It's the infection. It's very, very infectious this time around. So please, just step out when necessary. Mask yourself. If you have the opportunity to get vaccinated, please get vaccinated. I think as far as the government is concerned, they're trying to streamline, they're trying to upend the supply chain. That's about pretty much what you can do. I mean, I would even appreciate mini lockdowns in places, micro lockdowns.
Yeah, and just wanted to get in your view as to how you're looking at the overall healthcare system in the country, given the fact that, there isn't much health insurance coverage for a majority of the population. The kind of public spending that we've seen on health as well has been suffering quite significantly. How are you looking at the overall burden on the healthcare system or the future of the healthcare system in the country vis-a-vis what we've seen overseas with our massive population?
I think first and foremost, this is going to have huge amount of, ricocheting effects going into the future. You have, as far as private hospitals are concerned, you're aware that majority of the burden is being taken by the tertiary care hospitals, amongst the private sector as well. And these hospitals are largely given to quaternary care and more serious diseases like liver transplants, cancer surgery, so on and so forth. I think the problem is that once you have majority of your capacity allocated to COVID, a lot of people are having to delay life-saving surgeries, life-saving procedures, and so on. And going forward, you're going to have health to pay as far as that is concerned. So the disease burden is going to grow, and the cost of that is going to grow in future as well. As far as the COVID crisis is concerned, the public healthcare system, whatever you may want to say about it, is free. Even there have been price cappings as far as the private sector is concerned. So, I think nobody's really looking at profitability at this point in time, and nobody should look at profitability really at this point in time. But I think, the volumes are there, and, we all have to stand in service. So I think that's where we are. As far as the long term is concerned, I think clearly a lot more infrastructure needs to be created. This may be the second wave, but not necessarily the last wave. We have to use this time to be able to create that infrastructure. The government needs to perhaps make it a priority sector, both from a private standpoint as well as, from a public standpoint. You need to be able to create more infrastructure. So I think that is perhaps the way forward. And of course, I think perhaps one silver lining through this whole, through the last 1 year is that the public and the private, partnership and collaboration has been stronger during this period than any time in the past. There is reliance, and might I add, trust as well, faith between the two. And regulations are in place to be able to sort of handle such situations again, like we're doing it this time around. But it really depends on the size of the beast going forward as well. If you have to have an end to this wave.
I see that you are trying to see a message. Would you want to respond to a message, or can I ask you a question?
Sorry, you'll have to repeat that.
No, Abhay, I just saw that you're trying to see something on your phone. So would you like to check something on your phone? I don't want to hold you back in case there is an emergency. Or can I ask you 2 more questions?
Please go ahead.
Okay. No, I just didn't want to hold you back in case there is an emergency. My next question is that scientifically, how would you like to assure our viewers and millions who would be watching this that this wave is not that dangerous? I have read a lot of information, examples and data which says that, look, the second wave is a bigger wave, but mortality rates and death rates are less. If that is the case, then why are all of us getting cases where there have been casualties between the age group of 30 to 50, even 40 to 60? Why is that happening?
I think it's the sheer numbers, it's the sheer volume of people in that age group who are getting infected, post the lockdowns, who come out to work. And this time around, we're seeing families, 7, 10 people, together getting infected, which was not the case in the past. So when your base is so much, what's going to even if you have a lower mortality, if one was to believe that, just the sheer numbers of that are significant and huge. I mean, today, everybody, every second person we know, you and I know as well, is perhaps infected. Every family, there's a member who's infected with COVID. This wasn't the case the first time around. So, what you don't want to do is be found in that corner case situation where, although the mortality rate is low, you are in that little common factor. So, we need to keep safe. There are no two ways about it. I mean, if you're asking me for assurance in terms of how people will be safe, I think the only way you'll be safe is by staying home.
That's the only way. Vaccine, stay safe, mask yourself, stay at home. So just one more follow-up question, and again purely about your understanding of the second wave. It's sad, disturbing, but unfortunately true that children are also getting the virus this time, which was not there in the first time. Now, what has been the experience at Max? If are the children who are getting admitted to the hospitals, if they are, what are the protocols being followed? Because frankly, I have not read any paper which says that these are the protocols which need to be followed when it comes to children who are suffering with COVID.
Most of our hospitals have specialized areas, specialized treatment for children. So you have PICUs, which are pediatric ICUs, where whether it's the nurses, whether it's the staff and the doctors and so on, they are trained, they're skilled in dealing with children. This is the age group, anything between 3 and 16, and thereafter move to the adult ICU. Not that the adult ICUs cannot handle, but the pediatric ICUs are much more skilled at that. Fortunately, the numbers are, although numbers are there this time around, they're not so significant even yet, and we're hoping it keeps, it's kept that way. But yes, the infrastructure, the protocols, the manpower, the resources, all of that is in place. It's not everywhere, in all hospitals in the country, perhaps in tier 2, tier 3 cities, you're going to have that challenge, like the other challenges that they have. But, at least as far as Max is concerned, we are prepared for it.